Thank you. The Honourable Member Calgary-Fish Creek, followed by Dunvegan Central Police Notley.
Thank you, Mr. Speaker. The story of Greg Price is tragic. It was told in vivid detail in December's Health Quality Council report. Greg died 2 years ago at the age of 31 of testicular cancer. It's tragic because the barriers Greg faced while trying to access health care were well known by this government. The report notes 6 surveys over 10 years, each identifying the same fundamental problem, a systematic breakdown in communication. The breakdown prevented Greg from receiving timely care. To the Minister, Greg's story is not unique and it's not new. Why, after a decade of knowing this...
Honourable Minister.
Well, Mr. Speaker, really want to thank the honourable member for the question, and the story of that young gentleman is indeed very tragic. However, Mr. Speaker, as the honourable member knows, the primary conclusion of the report was not only that there was a failure of communication, but there was a failure at several junctures in the course of Greg's care for physicians to communicate and share information regarding that patient. As a result of that report, Mr. Speaker, we have begun work with the College of Physicians and Surgeons and other health professionals to determine what can be done to ensure those breakdowns don't occur.
Supplemental, please.
Thank you. Given that a priority in the 2010 5-year health action plan is now also a recommendation in the report following Greg's tragic death, and given that the recommendation was to create an e-referral system connected to Netcare that would standardize the referral process, can the Minister explain why Albertans are continuing to wait for this government to follow through on a 4-year-old promise?
The Honourable Minister of Health.
Well, Mr. Speaker, that was certainly one of the recommendations, and we certainly are looking at the e-referral system in conjunction with Alberta Health Services. But the primary conclusion of the report, Mr. Speaker, is something I think all of us can benefit from reflecting upon, and that is, first and foremost, physicians have responsibility and accountability for the care that they provide to patients. And that includes, as the report demonstrates, Mr. Speaker, communication that occurs when the patient is with a physician and when the patient is referred to another physician.
Honourable Member, final sup.
Thank you, Mr. Speaker, and that leads into my next question. Given that the report spoke of doctors not being informed about patient care in emergency, not being informed about care their patients receive from specialists, and not being informed about the patient's diagnostic tests or their results, how can Albertans needing health care today be assured that they won't fall through the same cracks as Greg did?
Honourable Minister of Health.
Well, Mr. Speaker, first and foremost, what patients can rely on is the fact that this government, and I believe physicians as a community in this province, recognize that there is a great deal to be learned from this report. Mr. Speaker, again, the primary recommendations are around the accountability of physicians for the care that they provide to patients, both the care that they provide directly and the responsibility to share information when they make referrals to other physicians and when they receive results of tests to share those with other physicians as well. That is the learning, Mr. Speaker, from this very important report.